Most people these days go to a hospital in order to not die, right? So the worst thing is to go to the hospital to not die from one thing and to end up dying from something else.
I was extremely healthy before I went in the hospital.
Actress Alicia Cole was literally the picture of health. So vibrant, she was cast to play doctors and nurses for commercials.
Fairly typical for an overweight woman in her 60s.
Then, 3 years ago, she went to the hospital for the removal of some uterine fibroids.
It was going to be just a routine procedure. It would take 2 days.
While in the hospital, she contracted a flesh-eating disease.
Necrotizing fasciitis. For the longest time, I couldn't even say the words. My stomach just rotted right before my very eyes. It was horrible.
On a scale of 1 to 10, she described the pain as a 25.
My 2-day stay turned into 2 months, turned into 14 months of follow-up at home, twice-a-day nursing care. When you go into the hospital for a procedure, you shouldn't then get sick.
Alicia was lucky. A report from the Institute of Medicine found nearly 100,000 people die each year from preventable hospital errors. One solution might be in the palm of our hands, and the fingers for that matter. Hand washing.
Doctors should wash their hands. We've known it for 160 years, and yet changing behavior is really hard.
Take the case of some doctors in Australia who claim they were washing their hands 3/4 of the time. Their actual hand washing rate, just 9%. At Cedars-Sinai Medical Center in Los Angeles, Dr. Paul Silka led a campaign to compel all doctors to wash their hands all the time.
We had to give them a visual example of what their hands would look like if they didn't wash their hands.
And what do they look like?
They look nasty.
It was so gross, they put this picture on all the hospital's screensavers.
Physicians realize that they're putting patients at risk if they're not executing on hand hygiene.
It was so successful that not only did it make Cedars-Sinai hand hygiene improve to almost 100%, but hospitals around the country started to copy the solution.
Of course, washing your hands might not be as easy as it seems. We followed a nurse, and in just 10 minutes, she washed her hands 20 times. Cedars-Sinai is going even further. Reminders everywhere you turn to stay clean, special antibacterial curtains, even disposable stethoscopes. It may seem like a lot, but every bit helps in the war on hospital infections when lives are at stake. For her part, Alicia Cole has turned her experience into an opportunity to raise awareness.
And when I'm speaking out, I'm trying to save you and your loved one. My family knows what to do now if someone else gets a hospital-acquired infection. I'm speaking out so that all those other people, my friends, the people at the bank, the people at the grocery store, so they can keep it from happening in their family. I can't turn my back and be quiet about it. I won't. People are dying. And so if my friends feel like they want the old me back, she's gone. She's gone. There's a new me.